Hi, my name is Allison Kerwin, and today I'm going to be speaking to you about the association between haptoglobin and cow and herd level outcomes. Haptoglobin is an acute phase protein observed at negligible blood concentrations in healthy dairy animals, but will increase over 100-fold at the onset of inflammation. Previous research has demonstrated that haptoglobin concentrations increase in cows and calves as a result of a stressful event such as transportation. Other studies have demonstrated that animals with elevated postpartum haptoglobin concentrations have an increased risk of disease, particularly metritis, decreased milk production, and poor reproductive performance. However, these previous research trials established haptoglobin thresholds on limited datasets, often from controlled research trials and not from large epidemiological studies. Measuring haptoglobin in fresh cows may help us to identify cows that are at a greater risk of developing disease or provide additional tools for herd level monitoring, which may help dairy producers improve their health management programs. Which leads me to the objectives of my study, which were to establish cow level thresholds for haptoglobin concentrations for predicting health disorders, evaluate the association between elevated haptoglobin on milk production and reproductive performance at the cow level, and we also wanted to identify herd alarm levels that are associated with herd level changes in disease incidence, milk production, and reproductive performance measures. This was a large epidemiological study, so we went to 72 farms that were located in New York and Vermont, and we took blood samples from 11 to 24 animals on each farm that were 0 to 17 days in milk. And we strived to take approximately 1/3 of those samples from first lactation heifers to reflect herd demographics. However, we were only able to measure haptoglobin concentrations on the animals that were 0 to 12 days in milk, so we have 988 animals in this data set. We use SAS software for the statistical analysis. For the first objective, the association between the health disorder of interest and haptoglobin were analyzed with a mixed effects Poisson regression. If haptoglobin had a p-value less than 0.1, a receiver-operator characteristic analysis was done to determine the critical threshold. The cows were then dichotomized as having high or low haptoglobin concentrations based on that threshold, and the generalized linear model was reassessed. We observed animals with a haptoglobin concentration of at least 0.55 grams per liter were 2.5 times more likely to be diagnosed with metritis. Animals with a haptoglobin concentration of at least 0.68 grams per liter were almost 5 times more likely to be cold within 30 days of milk. And animals with a haptoglobin concentration of at least 1.52 grams per liter were 6.6 times more likely to be diagnosed with metritis, clinical ketosis, displaced abomasum, or any of those 3 disorders. For the second objective of my study, we investigated the relationship between the thresholds just identified in milk and reproductive performance. Mixed effects models were used for the milk production analysis. Conception within 150 days of milk was analyzed by a Cox proportional hazards model, and conception at first service was analyzed with a mixed effects Poisson regression. The thresholds reported for this analysis are the lowest thresholds, which had the largest estimate and the strongest association with the outcomes at the cow level. Animals that had a haptoglobin concentration of at least 0.55 grams per liter produced 386 kilograms less 305-day mature equivalent milk at the 4th test day, which is approximately 120 days of milk. In addition, these animals also had a 25% decreased risk of conceiving by 150 days of milk. Animals that had a haptoglobin concentration of at least 0.68 grams per liter were 0.8 times as likely to conceive at first service. Now, we would like to note that we did see an effect at the 0.55 gram per liter cut point. However, it was not as strong of an effect as the 0.68 gram per liter. And just to look at the conception by 150 days of milk a little closer, this is a Kaplan-Meier graph. So we have the percentage of cows that are not pregnant on the y-axis and days of milk on the x-axis. And as you can see, all of the cows are not pregnant during the voluntary waiting period, and as time increases, more and more cows become pregnant. So you can see the animals that have elevated haptoglobin concentrations are in the blue line. Those animals had a median days to conception of 114 days, compared to 101 days for the animals that had low haptoglobin concentrations. For the herd alarm level analysis, we used mixed effects models to evaluate the proportion of animals with elevated haptoglobin concentrations on disease, milk, and reproductive measures. We used the thresholds previously identified, and 30% was the initial proportion evaluated. and that proportion was lowered in 5% increments to increase the sensitivity until the smallest proportion yielding the highest estimate and lowest p-value were determined. So herds that had at least 20% of their animals with a haptoglobin concentration of at least 0.55 grams per liter had a 5.8% increase in disease incidence. Herds with at least 10% of their animals with a haptoglobin concentration of at least 1.52 grams per liter had a 2.5% decrease in 21-day pregnancy rate. And herds with at least 20% of their animals with a haptoglobin concentration of at least 1.52 grams per liter had a 6.4% decrease in conception risk at first service. And I would like to note that we did not observe a herd alarm level that was associated with milk production or 21-day conception risk. So depending on the threshold identified in the herd alarm level analysis, this is the prevalence of elevated haptoglobin in the herds involved in this data set. The proportion of animals within a herd that had elevated haptoglobin concentrations are grouped into different risk groups, as indicated on the x-axis. And the percentage of herds in that risk group are indicated on the y-axis. So depending on the herd alarm level used and the outcome of interest, 13 to 56% of herds we sampled were below that herd alarm level. And this would indicate that we have room for improvement in the Northeast dairy industry, and we should investigate the cause of the inflammation that's resulting in increased levels of haptoglobin. We found that elevated haptoglobin is associated with disease, decreased milk production, and poor reproductive performance, which supports previous research. In addition, this research provides the opportunity to evaluate haptoglobin status at the herd level. Now, although previous work has established herd alarm levels for metabolites associated with energy balance, measuring haptoglobin at the herd level provides a unique opportunity to address non-nutritional challenges such as management and environmental aspects that may be associated with inflammation. But we do have to consider the practical use of this, whether we use this tool more for identifying individual animals or more as a herd level monitoring tool. And as of right now, I would say that this is probably more practical for herd level monitoring, just because we do not have a cow-side test available for measuring haptoglobin concentrations. So by the time we take a blood sample from an animal and send it off to a commercial lab for analysis, we may have already diagnosed that animal with the disease before we get those haptoglobin results back. And there are a couple commercial labs that will analyze haptoglobin for you, one being the University of Guelph, which is where we sent our samples to, and the other is Kansas State. And I would like to note that I know the assay that Kansas State uses is not valid on plasma samples, so you do have to be careful as to which tube type you use. So I'm making the general recommendation that you should always use serum tubes when collecting a sample for haptoglobin analysis. I briefly touched on this before, but we need to identify the source of the inflammation in these animals, which is why I will be evaluating the association between elevated haptoglobin concentrations with non-nutritional factors such as stocking density, commingling of the heifers and cows, and even looking at the Penn State particle separator. But we can't rule out the nutritional factors either. So we are going to evaluate the association between elevated haptoglobin with nutritional factors as well, and looking at that relationship between the far-off, close-up, and fresh period nutritional strategies. And this will provide the industry with more information as to which factors are most likely associated with inflammation, and then we can address them at the herd level. I would like to acknowledge that this study was partially funded by the New York Farm Viability Institute, Pool and Grain, and Elanco US. We also received a multi-state hatch grant for this work. And I want to send a huge thank you to the participating farms, nutritionists, and veterinarians, and the numerous people who assisted me with data collection. And of course, my advisor, Dr. Tom Overton, and the other study collaborators, Dr. Daryl Lanham and Dr. Buzz Burhams. Thank you.